If you're viewing this on the VLE or floated by on YouTube, a very warm welcome. My name is Rory Lees-Oakes, and in this presentation we're going to look at the difference between counselling and other helping activities. First thing we're going to do in the presentation is have a look at what's called a standard definition of counselling, and I've taken one from the British Association of Counselling and Psychotherapists, the BACP, which is the largest organisation in the UK that oversees counselling and counselling ethics. They state that counselling takes place when a counsellor sees a client in a private and confidential setting to explore a difficulty the client is having, distress they may be experiencing, or perhaps their dissatisfaction with life or loss of a sense of direction and purpose. It's always at the request of the client, and no one can be properly sent for counselling. So right at the very beginning we get an idea that people have to want to go to counselling. Although sometimes people are sent, it's usually not very successful. People want to have to go to counselling to try to get an understanding of where they are in life or what dissatisfactions they have. Now we're going to look at the shared values of the helping professions, because counselling and other helping professions have shared values. So to better understand what counselling is, we need to understand what the shared values of other professions are. Well, first of all, respect. I think it should go without saying that if you go to a doctor or a teacher, you should be treated with respect. There should be accountability. So say for instance you need to make a complaint, one of the shared values would be that the complaint would be handled in a professional and respectful and transparent way, and you would know the outcome of it. Hopefully all helping professionals should show empathy, and empathy is trying to see your point of view, trying to see how you are viewing things. There should be a professional approach. Practitioners should be qualified, or at least working towards qualifications. They should listen to your concerns, offer choice, offer confidentiality, and it's about you. It should be person-centred. It should revolve, any treatment or intervention should revolve around what you want. Helping professions should all use counselling skills, and I've defined these as empathy, being genuine and truthful, and displaying a non-judgmental attitude. Now these are things that people who use counselling skills should convey. So what's the difference between this and counselling? Well, let's have a look at a doctor. A doctor is a physician. They're qualified in medicine. They have defined confidentiality. They give advice. Why else would you go to a doctor if not to get advice? They prescribe. They can prescribe medication, or they can prescribe operations. They can refer you to other professionals, and this links into the confidentiality. It might be that 2 or 3 different professionals know your personal details. They would have to do that to be able to move on your treatment program. They have limited time. A doctor has enough time to be able to see you and make a diagnosis and then decide on a course of treatment. They work to a medical code of ethics. They have a defined role, which is that they're not a qualified counsellor. The main focus is to diagnose, treat and heal. What about a teacher? Well, a teacher is an educator. They're qualified or working towards a qualification in teaching. They have defined confidentiality. So again, it might be that they share information about a learner or a student amongst other professionals. They give advice, and if you're being taught, you certainly want your tutor to give you some advice on to how to prepare your work, how best to pass examinations. Teachers have a code of practice. Again, they have limited time. In a classroom environment, a teacher may only be able to spend so much time with a learner, perhaps a little bit more in tutorials, but generally speaking, they've got limited time. They have a defined role. They're not a qualified counsellor, and their main focus is to teach and assess educational support. So what does a counsellor do? Well, a counsellor is qualified in counselling, or at the very best should be in recognised training. They have defined confidentiality, and I think it's safe to say that counsellors work to a very narrow view of confidentiality. There are certain things that they have to disclose, but generally speaking, they wouldn't be speaking about you to other professionals unless you gave them permission to do so. They do not give advice. Counsellors don't give advice. If you want advice, why would you pay to see a counsellor? You might as well speak to your next door neighbour. They contract with you. So when you go to see a counsellor will ask you to contract, and that means that they will talk and you will talk about the length of sessions, the amount of sessions, any cost implication if it's paid counselling, what you expect from therapy. They'll also tell you a little bit about themselves and in terms professionally, although they won't tell you anything about them personally, they wouldn't share their personal details with you, but certainly their professional qualifications maybe, and also the type of therapy that they practice in. Counselling is a managed activity, so what does that mean? Well, counsellors go for regular supervision. They take their client work to a supervisor, that's somebody a little bit further on in their practice and qualified to supervise counsellors, to discuss casework and see if they can get a better understanding of how they can help you. There's a presentation on YouTube about supervision. Why not watch that to get a better idea? You lead the way. So the counsellor will go wherever you want to go with your conversation. This is about you. It's about sharing your emotions, about finding out what you want to do, to change, or maybe to accept. You choose counselling, and this is important because that means that you've made an informed choice to go to see somebody. If you were seeing a doctor or a teacher and they started to counsel you, asking about emotions, asking about deep-seated feelings, it may be that you don't want to share that. It may be that that would be difficult and you may not want to discuss that. You may want to discuss exactly what you went in for. So you choose counselling as a client, you choose to go. Counselling has a code of ethics, and we're going to look at some of the bodies who oversee ethics in a second. And you have set appointments. So you can see there's quite a difference between the other helping professions we've looked at and counselling. The key things really are the contract, regular supervision. Counselling has a code of ethics. They're qualified counsellors and it's defined confidentiality. So confidentiality, you know exactly when a counsellor may break confidentiality, and usually they wouldn't share your information with other professionals unless you gave them permission to do so. A counsellor should be a member of a professional body. And let's have a look at some of the professional bodies. Well, the BACP is the leading body for counselling and psychotherapy in the UK, and a lot of people who practice counselling are members. Psychologists would be members of the British Psychological Society. Different forms of therapy have different overseeing bodies. The ITAA is the International Transactional Analysis Association, and it oversees practitioners who practice the therapy of what's called transactional analysis, or TA. The Counselling Society is another organisation that has a code of ethics that practitioners who practice counselling can join. If you're viewing this in Scotland, then COSCA is Scotland's professional body for counselling and psychotherapy. They're equivalent to the BACP. A new idea in therapy is called Human Givens, and they have their own organisation which is called the Human Givens Institute. And finally the UKCP, the UK Council for Psychotherapy. So your counsellor should be a member of one or maybe more of these organisations. If you're unsure, if you're watching this and you're looking for counselling or you need further advice, then two good places to contact would be, if you're in the United Kingdom, the BACP, which is www.bacp.co.uk. Their phone number is 01455 883 300, or their email address is info@bacp.co.uk. If you're in Scotland, you might want to contact COSCA, that's COSCA, and their internet home is www.cosca.co.uk. Their phone number is 01786 475 140. Email is info@cosca.co.uk. For further information, well, if you're watching on the VLE, if you click the resource tab here above the red arrow, you'll be able to download the PowerPoint, which has the links of the professional bodies we've discussed in this presentation. If you're watching on YouTube, then you'll have to just copy them and write them, I'm afraid. And finally, thank you for watching.